Morning. Today we want to talk about SOT, which stands for Sacro Occipital Technique. It's based on the concept that everybody in the whole world is either normal, Category 1, Category 2, or Category 3. Meaning it's like a hurricane. The higher the category, the worse you are. So if you're a Category 3, that's a serious lumbar problem. It's affecting the disc. Okay, that's why you're on your feet, it makes it worse. Basically, working out everything you do makes it worse. Category 2 is a little bit different. That means that the whole foundation of your spine, instead of being like this, has completely slipped out of place. It's considered a sprain strain of the sacroiliac joint, which is the foundation of your spine. That's why when you get up in the morning, you're stiff. You may want to relate to this. A lot of people get up in the morning, they're stiff. They move around, they take a shower, they move around, they walk around the park, and they get better. That means if that's like you, that means you're a Category 2. You should probably come in the office, get evaluated, and we can check you out. Category 1 is the lesser of the categories. That basically means that you have hard bone out of position, pressing on soft nerve. It's what is called a subluxation. Think of it that your spine is basically torqued, and what we want to do is we want to take pressure off the nervous system and basically untorque you. If you were in the office, it would basically look like this. This is considered the Category 1 blocking. Okay? Okay, for a Category 2 adjustment, of course, the patient would be supine. And then we're going to flip you over on your back. Now we're going to give you this board right here. You'll lean up against the board. That's it. That's comfortable for you there? Mm-hmm. Now the Category 2 blocking is like this. Now the good thing about the Category 2 blocking and all the blocking is the patient's own body weight does the correction. So as the patient is on the blocks, their own body weight is adjusting the hips, the low back, and the pelvis and the sacroiliac joint. To speed up the effectiveness of the treatment, the patient can breathe through their nose, breathe through your nose, and as you do, bring your toes up, inhale, slowly exhale, slowly release the feet. And then you just continue on with that. And basically what this is doing, this is pumping cerebrospinal fluid all throughout the spine, which is the lubrication for the spine. Think of the categories as sort of like you would look at a hurricane. So the higher the number, the worse you are. So of course 2 is worse than 1, 3 is worse than 2. So basically if you're Category 3, we want to get you to a Category 1 as soon as possible. And then basically you're a tropical storm, and then you're a light drizzle. To get the patient off the blocks, this is part of the adjustment. Bring your leg up like this, rotate, and basically that's part of the adjustment, and that corrects the Category 2. Usually in about up to 4 visits, the patient is tremendously noting a difference with that. Now for Category 3, we're going to flip you over. Let the table do all the work. The table knows you're under. And you'll be face down. And again, in this position, the patient's own body weight on the blocks does the correction. Now this is an effective treatment for a disc. 99 times out of 100 in my experience, you don't need surgery for a protruding or a bulging disc. Only about 1% actually has a ruptured disc where you would need surgery. So this is the Category 3 blocking for a disc. As the patient lays on the blocks, the patient's own body weight is actually adjusting the hips, the low back, and the pelvis, and it's actually sucking the disc right back into the disc space. And that covers all 3 categories. If you have any questions, you can call our office. If you feel like you're a candidate for any kind of, let's say, chiropractic care, we can evaluate you. This is good for like back pain, sciatica. Usually if you have a disc, you have sciatica. So if you have sciatica, that means you're probably Category 3. If you have like whiplash injuries, neck injuries, mid-back pain between the shoulder blades, scoliosis, if you're tired all the time, if you're not sleeping good, usually if you're not sleeping, that means you have spinal cord pressure. If you have spinal cord pressure, that means usually you need a chiropractic adjustment. If you have any questions, you call the office for an evaluation. We'd be glad to check you out. Thanks for stopping by.